Hi, everyone. Bob Dietrich here with the ADHD Toolbox. And on this edition, we have a special guest, Linda Roggli. Linda, welcome to our program.
Appreciate it. I love to be here.
Yeah, and you know, we're talking about an important, really important subject today. And it's important because, 85% of people who opt into the toolbox, and I'm sure this is not just for the toolbox, but anybody, opting into ADHD information, are female women that are coming in. Some of them are mothers looking for solutions for their children, and some of them are women with ADHD. And we're going to focus strictly on women. But if you're a man watching this, stay tuned, because maybe you'll learn something about women with ADHD, and this will be helpful for you to learn something about how to work better with them and connect better. So Linda, welcome to our program. And let me tell you a little bit about Linda. Linda is a professional certified coach, award-winning author, and founder of AD Diva Network for ADD and ADHD women 40 and better. And she is an internationally recognized expert in midlife and senior ADHD. She's co-founded the annual ADHD Women's Palooza, which is just finished. If you're watching this, yeah, that was in February of 2020. And she is the ADHD Parents Palooza, which is coming up, a week of online conversation with 30 plus ADHD experts. She's also the author of a book called Confessions of an AD Diva, Midlife in the Nonlinear Lane, and won first prize for women's issues on the prestigious Next Generation Indie Book Awards competition. She's a regular contributor to ADD or Attitude magazine, as has contributed to chapters to several ADHD books. She chairs a webinar committee for ADDA, which is, you can find at add.org, and maintains a lively support group in North Carolina, which she lives in Durham, North Carolina, with her slightly OCD husband, one OCD cat, and 4 adorable ADHD Sheltie. So you got your hands full.
I'll take the hair off of my shirt. I went to the gym this morning, and the guy said, "Oh, there's some cat hair on you." I said, "No, it's probably dog hair."
Well, we had a chance to talk a little bit before this interview, and I find it fascinating that there's such a big, stark difference between men who have and boys who have ADHD and women and girls who have ADHD. So let's talk a little bit about that. You want to start at the beginning, like at babies. So let's do that.
As I said, I really want to start with when we're babies. I mean, not that we can diagnose ADHD when we're infants. That's not what I'm saying, although some mothers might disagree with me there. But what I wanted to say about that was we're going to really talk a lot about hormones, and in particular estrogen today. And when we're born, girls are born, their brains are bathed in estrogen. And there have been a lot of research, gold standard research, that shows that girls, tiny, tiny infants, when you bring a human face in front of it, they're fixed on that face. Boys, not the same. So girls are inborn, literally, with this relationship predisposition, if you will. And that's important to remember as we talk about ADHD girls as we go forward here. Mm-hmm. So keep in mind that estrogen, when we're little girls, it's a little tiny bit of estrogen, and it stays pretty level. I've actually done some research to see exactly how much that is, and it's surprising how steady it is all the way through childhood until we hit puberty, and then it goes ka-choom like this. Now, that is one of the reasons that girls tend to be diagnosed a little bit later than boys. Mm-hmm. Boys tend to be, especially hyperactive boys. Now, not inattentive boys. So some of the things I'm going to be saying today may apply to inattentive boys as well. But hyperactive boys, easy to see, right? They're the kids with the, wearing the desk on their head, rocking around the classroom. They're the fidgety ones. Little girls who have hyperactivity are the chatty Cathys. They're going to be talking all the time. They're going to be nudging. They're going to be looking around. They're going to be doing that kind of stuff. Or inattentive girls, like inattentive boys, maybe the space cadets kind of looking out the window, which does not mean that their brains are not going a mile a minute. They are. We all ADHD folks have hyperactive brains. And I didn't say this particularly in my bio, but I'm an AD Diva. That's why I founded the AD Diva Network, because I needed support for myself, so I just decided to invite everyone else in. That worked out beautifully for me, actually.
Right.
So inattentive boys and girls tend to be diagnosed a little bit later. Inattentive boys may be picked up because of grades are not doing so well. All of a sudden, they're, you know, they've been good, but not causing trouble in the classroom. But then suddenly they get grades that are not so good. Girls may have the same issue, but girls tend to have a little bit more trouble making friends. The ADHD pushiness, sometimes bossiness will take over. Inattentive ADD girls will tend to hang back a little bit, so they won't push themselves into the group. So you have two different kinds of things going on. Inattentive and hyperactive here. Again, very different from boys. They're not generally, ADHD hyperactivity for girls doesn't generally show up as physical hyperactivity. It's more about motor mouth and clicking your pen and, you know, moving your leg and that kind of stuff.
Got it.
So as we move toward puberty, kind of keeping that estrogen in mind, as we move toward puberty, when estrogen goes crazy, that's when more ADHD girls are diagnosed. And the reason is that estrogen plays a huge role in our brains. Strange, but that little, you know, female hormone, which males have estrogen too,
Right.
actually helps brain connections. And I know this week, I'm sure you've talked about neurotransmitters, and in particular dopamine.
Mhm.
Estrogen's kind of that little sticky catcher's mitt over there as it's trying to catch that, you know, those neurotransmitters and say, we're going to make them be effective. That's a little simplified, but nonetheless, when estrogen's not there, they don't really do this, but I have this image of them kind of lackadaisically going around, not being able to find good connections. And that's when ADHD symptoms go up. So it's not surprising then that girls in puberty begin to show more ADHD symptoms, especially when their periods start, and they may have irregular periods at first, but that up and down estrogen swing makes a big difference.
Got it. Got it. So, what age do they start to be diagnosed then?
Well, it depends on puberty for girls, because puberty can start as early as 9. I mean,
Okay.
actually, I've even heard, you know, girls are starting to get pubic hair. And actually, my niece, as a matter of fact, when they were 8 years old, that did not mean that her puberty started. She didn't start her periods for a couple of more years. But as early as, you know, 8 or 9, all the way up to as late as 15.
Mhm.
And maybe even later than that. I'm not a doctor. I'm not a physician. So I'm just giving you some general ranges here. But what I will say, though, is that there there have been studies it's unfortunate that girls tend to have a more intense experience of ADHD than
Mhm.
boys do. And one reason for that is that when boys get in trouble, let's just take elementary school boys, when they get in trouble, it's almost kind of a badge of honor in the boy community, right? It's kind of like, oh my, I got to go to the principal's office or whatever. I mean, it's not popular with parents, trust me, I understand that. but girls, when they get in trouble, so boys are externalizing it. There's, you know, it's the dog ate my homework and he made me do it and that kind of stuff. So this is not a blanket statement, but it's generally speaking.
Right.
Girls generally tend to take that criticism in, even if it's an eyebrow raised or they're very, very tuned in to what other people are thinking of them. At least at some point they are, especially in adolescence. But girls tend to take that stuff in and feel like, oh, even just a little bit of criticism, it's like, oh, there's something wrong with me. I'm bad. I've done something wrong. And you can imagine how layer upon layer upon layer upon layer of that ends up giving girls, especially in adolescence and late adolescence, really serious issues with self-esteem.
Yeah.
And that's one, and you couple that with the up and down, and we'll talk a little bit more about periods and hormones, but the up and down estrogen roller coaster that they're on with their monthly cycles. And that also coincides with their ADHD symptoms going up and down as well, inversely relates to that. So when you have girls that feel so bad about themselves and there's something wrong with me and they don't like me and they're having trouble with friendships, that just perpetuates that belief that there's something wrong. So boys tend to not have that quite as much. There are some boys who are very, very sensitive, and they may have that same issue. They may have trouble with friendships. You get to a certain age, it's not such a big deal to be sent to the principal's office. It's more of a detriment than it is a positive for them.
Mhm.
So girls, especially in adolescence, be careful if you have daughters with ADHD. Keep an eye out for that, because even if they're not telling you, they may be internalizing and taking that in and responding in a way that leads them to what a lot of people call the imposter syndrome, which is
Mhm.
when we put this wall up that says, I'm going to be this over here. Don't go behind that wall because you don't like this. So I'm going to pretend to be this.
Yeah, and in my conversations with other experts, especially regarding bullying, I understand that bullying happens totally different with girls than it does with boys, and that taking that in internally is a real factor with bullying. Can you just talk about that a little bit?
Well, sir, I'm not an expert on bullying, but I can tell you that the studies show that ADHD children across the board are bullied more often than boys, than other children are. And they also are, I read a study that said, once children or classmates find out that the child has ADHD or the student has ADHD, they treat that student differently and ostracize them more often. So identifying it seems like a good idea because we really want to treat these kids. As
Right.
you probably have heard over and over this week, early treatment is really, really important. The earlier you can catch this, maybe not when she's an infant, but later in life, the better chances she'll have of living that rich, satisfying life that you know you want her to live. So yeah, I think bullying is a big issue, and it takes a nosedive to self-esteem. Girls don't really know how to do that, but it's the mean girl effect, right?
Yep. Right. Exactly. Exactly. So, what I've also learned in interviewing so many experts is that as you grow up as a child and you're growing up through your teen years, you start to get beliefs about yourself because of the experience that you're having with ADHD that just aren't true, and you carry these into adulthood, and those beliefs, come into feed into what we're talking about with, and we're talking specifically about women with ADHD. Do you work with people with beliefs at all, and help to overcome those?
Well, I think everybody who works with ADHD folks has to deal with that at some level,
Right.
because people come in thinking and I'm a coach, so people come in thinking, I want to fix this thing over here. But what ends up happening by the end of our first session together is that there are so many underlying issues that
Hmm.
need to be addressed. And I'm not a therapist, and so therapy issues need to be addressed by a therapist. But there are things that sometimes people just need a little encouragement, and more importantly, someone to listen to them without that raised eyebrow and without that judgment that they feel so often from outside. So I think that women in particular, as I say, we begin to feel bad about ourselves. And I know that you've heard about rejection sensitive dysphoria, which has been popularized by Dr. Bill Dodson, a dear friend of mine.
Hmm.
And girls who are very sensitive will have their antenna out, and they'll be looking for something that, oh my gosh, there's something out there that may be bad, and they wilt very quickly. You may see that in girls as withdrawing. I certainly had that issue, although no one knew about ADHD in girls at all back in the old prehistoric days. But I read. Now, a lot of girls have trouble with reading. So one of the things that really surprised me when I learned about ADHD is a lot of folks with ADHD have those comorbid things going on with them, learning disabilities, including
Right.
dyslexia, which did not surprise me. But I was very surprised to hear about dysgraphia, which is very poor handwriting. And
Mhm.
people used to make fun of me with my handwriting because I can't even read this. I about fell through the floor one time when I was back in the days when you wrote checks at the bank. And I wrote the check and I handed it to her, and she said, the bank won't take this. And she gave it back to me to write it again. I wanted to fall through the floor.
Right.
So sloppy handwriting, messy handwriting, obviously disorganization. I'm sure you've talked about this week. Inattentive girls tend to be disorganized. They tend to be more easily distracted. And as we get older, there's fewer than 1% of adult women who are categorized strictly as hyperactive. As we get older, first of all, there tend to be more inattentive women diagnosed earlier. But as we get older, there's the combined type, which is a little dash of hyperactivity and a little dash of inattentive, which shows up at alternate times during our adult life. So somebody may have a lot of drive and go, and then have to come back home and just kind of fall apart a little bit and need to be quiet. Or it may be exactly the opposite. Maybe they need that external stimulation, which kind of tracks with introvert, extrovert, but not entirely. There's not been a study about that, but that's just my own personal observation. So that, going back to beliefs, how we hold our own self-esteem and our own self-worth is crucial to, frankly, how we treat our ADHD. And I'm sure there are moms out there who also have ADHD. Remember, there is a genetic component going on here. So a lot of moms are diagnosed when their daughters are diagnosed or when their sons are diagnosed.
Mm-hmm.
And my son actually has ADHD, and he's inattentive type, and I was more driven and more hyperactive. So we went like this a lot before we realized what was going on. Now that he's an adult, we laugh about it. Oh, there goes your ADHD again, kind of thing. So I absolutely work with people about beliefs, and really I kind of come back to, it's about listening to someone else. So if you can be that sounding board for your daughter, and it's possible that you can't be that sounding board, you actually may not be the best person for that because you're so hooked into a lot of other things about what's going on with them. Why can't they pick up their clothes on the floor? Why can't they get their homework done? That kind of stuff. It may help to have somebody outside, like a coach or a sympathetic teacher or a tutor, et cetera, et cetera. So enough of that.
Well, let's talk a little bit about your book, Confessions of an AD Diva. I love that name, by the way.
Oh, thank you.
What exactly do you cover in the book? What's the book about that you can tell our viewers about?
I would love to tell them. It actually is a memoir. And it's not its own, but it's a very thinly sliced memoir. It's an ADHD memoir.
Mm-hmm.
And when I was diagnosed in my 40s, which is when hormones came into action for me, I was diagnosed with ADHD, but I didn't really worry about it very much because I'm like, so I have ADHD. And then I would say, I don't really have ADHD. I've got a business, blah, blah, blah. And then I would think, oh, I do have. So when I hit menopause, the hormones went away, the estrogen went away, and my ADHD symptoms went through the sky. I mean, they were like sky high. And in fact, I went to a woman and I said, I can't even remember my address. And she said, leaned forward and she goes, oh, honey, it'll get better. She was a little older than I was. But I begged my doctor for ADHD medication at that point, and he said, no, you need estrogen, go get some. We'll talk about that in just a minute if we have time. But Confessions of an AD Diva, as I learned, what came from my experience of learning more and more about my own ADHD in retrospect, because I think when you're diagnosed, all of a sudden everything ka-chunk, ka-chunk, ka-chunk changes back there.
Right.
And what I realized is that a lot of the things that I thought were character defects, or that therapists had diagnosed as character, as psychological defects, were actually just related to my ADHD. Duh. I mean, it's just ADHD. And I don't want to minimize that. Right. Just ADHD is a very serious issue. I know you've had Dr. Barkley here this week, and Dr. Barkley has been the pioneer in making sure that we understand just how serious this disorder is. So the Confessions book takes little vignettes of my life to illustrate parts and pieces and parts of ADHD. For instance, the one about impulsivity, this chapter about impulsivity is the answer is always yes. Because I would always say yes to things, right? And so it brings people through that, talks about hormones, it was written for people who are at midlife, but I've had men read it and say, I identify with a lot of this stuff, except for the estrogen chapter, of course. But I bring it to, at the end, I bring it down to exactly what you've been talking about how we live with ourselves, and how I talk about putting my arm around my ADHD and walking down the yellow brick road together instead of pushing it away and fighting it all the time. I have talked to a lot of people, and the question always comes up, if you had a choice, would you get rid of your ADHD or would you keep it? And it's exactly 50% right down the middle. I have had people say I wouldn't give it up for anything. I love my ADHD, and I've had people say there is nothing good about my ADHD. And that's all about their own experiences and how they create it and whether it's treated or not. And remember, treatment for women is a little different too. So do we have time to talk about a little bit of that? Yeah,
before we jump into treatment, because that was one of my key questions, I wanted to see if you can go through real quickly, what are the symptoms? Like if you haven't been diagnosed, you have some of these symptoms, you may want to get diagnosed. And if you have been diagnosed, you'll probably recognize some of these. So what are some of the symptoms? And then let's talk about what you were going to talk about, which was
yeah. And treatment kind of ties back into hormones again too. I'm going to make sure, I'm going to look at my list because I don't want to forget something. I actually wrote an article for Attitude Magazine about this a little bit ago. Inattentive girls, I'm talking about inattentive girls and inattentive women, they tend to lose their places. You have trouble concentrating, so it's about focus. And Dr. Patricia Quinn, who's also been one of the pioneers in women and girls ADHD and has written several books about it, says that it's not that you want, when you're behind them and they're not focusing, if it's your daughter, you just want to say, come on, but the point is that number one, that makes it worse because there's more pressure to do that. But number two, it's not that they don't want to focus. They literally cannot focus because those brain connections just are not happening. That prefrontal cortex is not functioning. They may have amygdala hijack, which means that everything's all kind of crazy at that point. So you'll see that ADHD folks are kind of in their heads. They're intellectualizing a lot of things, and they may not think they're being intellectual, but they're intellectualizing a lot of things instead of they're trying to think them through, because we're really good problem solvers. ADHD folks have jillions of ideas, usually good ones. However, they fail to execute, but maybe this many of them. And even those we may have trouble with follow through. So I love to start new projects. Finishing them, not so much, because let's face it, we get bored in the middle. So like, oh, but that little shiny object over there looks more interesting. I think I'll go over there and do that. That proof positive of that is that my son is now 40 years old, and I still have on the embroidery hoops in my attic a pair of sweet little blue tennis shoes that I was embroidering to put on his wall. It is still in the hoops. So girls make careless mistakes. Although I will say, a lot of folks say, well, you can't focus on details. That's not true, because I like to say that non-ADHD folks see the world at about a 60-degree angle. ADHD folks see the world at a 180-degree angle. So we're taking in all this stuff and we're not filtering it. I think that's probably why the 60 versus the 180, but we're not filtering it. So we notice, oh, that guy probably has a flat tire, and oh, there's a little piece of lint over here. We notice all that stuff. That's different from making mistakes, because that may be about focus, especially in mathematics. It's very difficult for a lot of folks with ADHD, even if girls get through the elementary school with mathematics, because remember, until third grade, girls academically are a little bit faster and better than boys, but at third grade, everything shifts. Third grade, boys catch up and girls sometimes tend to fall behind a little bit. ADHD folks, women in particular, we stop doing things when they're going to require a lot of energy and focus. So in other words, I may not even start a project. I will say no to something rather than possibly failing at it. I know that sounds like that's two different things, but the failure piece is, I don't think I can finish that. On the other hand, we may say yes to, as I say, the answer is always yes. So we may say yes to a lot of other folks who say, can you help me with this? Oh, sure, I'll be glad to help you with that. Well, our own work suffers, right?
Right. And then you go into overwhelm, right?
Absolutely. And that's exactly the next thing I was going to mention, was that we get overwhelmed very, very easily. And I think that's one of the things that folks have to notice about their own ADHD as they look at, how do I handle this myself? Because throwing medication at it is not the only thing that you do with ADHD.
Right.
There's that great saying that says pills don't teach skills. If you didn't learn those skills when you were a child, and most ADHD folks didn't, you need to do that in cooperation or in connection with taking medication. Also, time disorientation is very difficult, and sleep disorientation or sleep dysfunction is very difficult. We lose track of time. It's been proven that ADHD folks think things, well, first of all, we think things will take less time than they will, because even though our brains are going really fast, so we think we can do things really, really fast. The problem is that execution is actually slower usually than linear or non-ADHD folks.
The physical can't keep up with the mental.
Exactly right. And that's why I have bruises all over my body, because I keep running into things, because my brain is going one way and my body's going another way.
Sure.
Sleep issues are endemic among ADHD folks. So if your daughter is a night owl, as I was even when I was in early high school, I would stay up late, and I usually would want to sleep late too. So lots of times, there's a wonderful psychiatrist in the Netherlands, Sandra Coy, who has done research that shows that our ADHD sleep disorientation is about 90 minutes later on average than people without ADHD. So I talked about follow through. What else do I want to talk about? Being bored. I mentioned being bored a minute ago. What I find to be true is that I can have lots of sleep, and I'm like on it, and if I go into a lecture that is just going on and the room's warm and I'm just like I'm falling asleep, but if somebody says something interesting, all of a sudden I'm awake again. So girls will do that in classrooms. We do it in college. We do it even when we're like, maybe I should do something exciting so that people will pay attention. No, I'm just kidding. And remember too that hyperactive girls will talk a lot. That there's that chatty Cathy, and sometimes that gets diminished because sometimes socially it's frowned upon. So by college, or perhaps even early adulthood, maybe that conversation goes down a little bit as we kind of the symptoms of ADHD mitigate a little bit as we get older. That's why a lot of women are able to kind of think ahead of their ADHD, because the women that I've talked to are usually brilliant. The problem is they feel like they've never lived up to their full potential. And you'll see that in high school, and you'll see it in college as well, that they should have graduated cum laude, and instead they're barely getting through.
Right.
And it's frustrating for ADHD women because we know we can do it. And that's another reason, back to that imposter syndrome, is that we hide. It's like, don't look too closely because I don't want you to, and I know way too many people that are way behind in their work, and they're just praying that their boss doesn't come by and say, where's that thing you promised me last Tuesday?
Right. Right. And so we have to manage our lives. I mean, if we have sleep issues, we still have to get up early and help our kids get ready for school. And I say I mean, these mothers that are out there, and these women that are struggling with ADHD. So management is vital. I mean, it's essential. So what are some of the management techniques that you've seen out there, and what's really worked the best, works best for you or your clients?
That's like saying, if you've seen one person with ADHD, you've seen one person with ADHD. What works is not universal. I'm going to back up just 1 second, because I just noticed in my notes that we had not talked about something that I think is really important, and I'd like treatment to kind of come at the very end of what we talk about. One of the things is that girls and young women, that's the studies have been done on those groups, but I suspect it's true even as we get older as well, have a much, ADHD in particular, has a much higher rate of self-injury and self-harm, cutting, burning, etc. And they also have a higher rate of suicide attempts, and they also have a higher rate of suicide successes. And I hate to even use that word together with the word suicide, but I just want you to be aware that kind of rewinding to the kind of one of the first things we talked about was that level of self-esteem can get pushed down so much that girls and women feel like, why even bother anymore? No one's going to miss me, et cetera, et cetera. So the only caveat I offer here is to take that seriously. And I don't mean to hover over your daughter or yourself for that matter, but if you have those thoughts, there certainly are options out there. And what I just found out from the Women's Palooza that just aired last week, from Dr. Roberto Olivardia, he said that a lot of people are afraid to mention the word. And as a matter of fact, it was one of the least watched segments of all the 30 that we had, because we had 30 people as well. And I was disappointed in that, because it was really important. And what he said was people are reluctant to ask anybody about it. And he said that actually is a better thing to do. Are you thinking about hurting yourself? You want to talk about this with me? And they may say no, but it may very well open a door. And he said that that's really, really important to suicide prevention, is to be not sit down, not like an alcoholic intervention, not that kind of thing where everybody sits around and says, we know you have a problem. It's more, I'm here. And I know there's some help out there, which kind of goes back to having someone else to talk to besides mom, because sometimes girls don't want to talk to their moms about these things. So I just wanted to mention that before we go.
Yeah. And so, let me also mention to our viewers that Dr. Barkley's interview is super important for you to watch. It talks about mortality rates in ADHD and how important this is the reason why you manage it. I know your life can be chaotic, and that seems like the reason, but the bigger reason is that your life expectancy is about 13 years less if you don't manage your ADHD. And that's for lots of different reasons, everything from you know, what we talked about with suicide and hurting yourself, but also thrill seeking, unprotected sex, alcoholism, drug addiction. All of these things are more prone if you don't manage it. And those are higher mortality rates than heart disease and cancer. So it's a very big deal. And the good news, though, is that when you do manage it, it's the easiest thing to overcome, you know, compared to, say, heart disease and cancer.
Well, I don't know if I agree with
Well,
that.
according to Dr. Barkley.
Yes, according to Dr. Barkley, I got it.
Yes.
And I respect him. He's been on the ADHD Women's Palooza often, and we appreciate that.
Right.
I did a study, excuse me, I did a survey of women, ADHD women who are 40 and better, as I like to call them.
Mhm.
And I had more than 1,500 women respond to that survey, which was amazing considering that it was 125 questions.
Mhm.
And we had 80% of them finish it. One of the things that I found out was, and this kind of goes along with what you're saying about life expectancy, et cetera. Not
Mhm.
many of them had attempted suicide, but some of them had. A small percentage had, and many of them said that they struggle with depression. And depression is on that same continuum as suicide. Suicide is obviously the end of it, but
Mhm.
it's very common for women to be diagnosed with depression before they're diagnosed with ADHD. And
Mhm.
even and there's that chicken and egg kind of thing. Is the depression because of the undiagnosed ADHD or not? But some people really do have both of them, back to the comorbidities, those coexisting conditions. I will say that I was just going to look at this. I just want to talk about, just before we talk about treatment, I just want to talk about one quick thing about hormones. Across the lifespan, hormones I mentioned at puberty, when they go up, that's great. But remember, in every cycle, that estrogen's going up and it's going down. And the point of when it's at its lowest point is just the day before the bleeding starts. So if you're finding that you have, you know, PMS or PMDD, much more common in women and girls who have ADHD, and right before your period starts, your
Mhm.
ADHD symptoms are out the roof. And one of the things, if you happen to be taking a stimulant or your daughter happens to be taking a stimulant, one of the things that Dr. Coy suggests is perhaps increasing the dose, because estrogen also impacts how effective, back to treatment, how effective that stimulant is. She also suggests that it's possible to have some relief from a very short, as in 3 to 4 days worth of taking an SSRI. Now, an SSRI is an antidepressant, and it's in the Prozac and Lexapro family. And I know it sounds counterintuitive, because usually when you take antidepressants, it usually is 2 weeks before they actually
Yeah,
reach
or
full
longer,
effectiveness.
right? Yeah.
And then you go on and it's better, better, better. But she says even a small 3 or 4 day dose of that is actually helpful for girls and women to get past this ADHD, you know, symptom that, you know, is sky high. And because remember, this is happening every 28 days, so this is pretty fast. Your estrogen goes down, it starts climbing right back up again, and so does progesterone at a little bit different level. But anyway, I just wanted to mention that. And I also wanted to mention that in pregnancy, estrogen goes really high, so some women don't take medication during their pregnancy, but for some of them that's okay, because the effects of the estrogen kind of override that. And there's a little bit of limited evidence now, new evidence coming out, that perhaps women do not need to stop taking their stimulants, because remember, if they stop taking their stimulants, then their ADHD comes up into full. Maybe they're not also taking their prenatal vitamins, and they're not taking care of themselves, which also can impact the fetus. So I'm going to leave that out there. You can Google that on Google Scholar, for heaven's sake. But at menopause is when estrogen goes crazy again. And remember, menopause can happen 10 years ahead of the actual cessation of menses. So you got these up and down and up and down and up and down and down and down and up and down and down and down. So ADHD symptoms are like, I'm fine, I'm not fine. I'm fine, but I'm really not fine. So 4 times then in women's lives, at puberty, monthly cycles, which lasts a long time, during pregnancy and menopause, those are very, very important times for estrogen levels for ADHD women. So treatment, we just touched on that just a minute.
And I'd like to also mention that, you know, I'm working with, I have a good friend of mine, Kim Kunkish, who is a expert in eating disorders, bulimia, things like that.
Yes.
And this is a very large community of people that struggle with this. And I would imagine that people with ADHD also are more susceptible to this. Right.
Four times the rate of eating disorders in ADHD women. I do not have statistics for men, but 4 times as many women with ADHD.
And
There's also a link between ADHD and fibromyalgia, and there's also a link between ADHD and polycystic ovary syndrome as well. So and I just finished an article for Attitude Magazine that there is some evidence at this point. There's not a huge connection, but there's some evidence that shows that diabetes, type 2 diabetes, and ADHD have a connection, and that's in part because we load up with carbs because carbs stimulate dopamine in our brains, and therefore that's an easy fix. That's another reason why jumping out of an airplane does it, because that boosts dopamine as well. There are lots of things that do, and unfortunately that can lead to some addictions, and I'm sure you've had somebody talk about addictions this week.
right.
But that's certainly important as well. So pay attention to that. And we're not talking about type 1. There's no connection between type 1 diabetes, but there is a connection between type 2 diabetes. And there is no connection, by the way, for those people worried about memory, no connection between Alzheimer's and ADHD. There is a couple of studies out. There are a couple of studies that say that there is a small connection between ADHD and cognitive decline or dementia, in particular Lewy bodies
Right.
dementia. So I'm planning to not do that, though. I'm choosing to not go there.
Right. And if you're wanting more information on eating disorders, you can look up a company, an organization, nonprofit called Feast. They have plenty of information there, and they can help you. I know they're a great organization, as is many others that are out there. So there is
Thank you.
help, and you're not.
I'm sorry, I didn't mean to interrupt you about eating disorders. I'm
Oh,
so
no,
sorry.
no, that's okay. That's okay. This is just a conversation, and we have so much information. It's bound to overlap. So
Exactly.
let's get into the management. So if you know you have ADHD or you think you might have ADHD, what are some of the management ways to manage it so you can get back into that brilliant side of your mind?
Well, the management for ADHD for women and girls is the same as management for everyone else. So you probably have heard it over and over this week. So I'm not going to dwell on this a lot.
Right.
ADHD medication is the first line of defense, right? And the reason it is because it works for 80% of the people who try it.
Mm-hmm.
Unfortunately, compliance is not high. The compliance level is not high. People say a lot of times, I just went to the professional ADHD, the ADHD conference for professionals in January, and they had talked a lot about does taking stimulants, especially for college students who tend to, even folks without ADHD want to take them so they think they can do better on the test, proven to be not true. Actually, the opposite has been true. But the whole emphasis was, does taking stimulants lead you to a dependence on stimulants? And there is absolutely no evidence that says it. As a matter of fact, it's the other way around. Taking stimulant medication actually decreases the possibility of addiction because so many people self-medicate. I have to tell you that I just talked to Dr. Ned Hallowell, and he says, my medication is caffeine. I drink coffee. So sometimes it's just as simple as that.
Right, because he can't take medication.
Exactly.
It doesn't work. He's one of the 20% doesn't work.
Absolutely. Absolutely. I think that the two things outside of medication, and remember there's stimulant medication and there's non-stimulant medication, and really, there are only two stimulants, and that's the Ritalin family, which is methylphenidate, and then there's the Adderall family, which is an amphetamine mixed amphetamine salt, which is the Vyvanse and all that stuff. And I'm disappointed that we don't have more options out there. They can continue to come out with new medications, but they're pretty much just reformulations of those same two stimulants. They're just different delivery systems, whether it's a patch or whether it lasts longer or whether you can take it the night before, like Jornay. But there are some amazing other drugs out there that are working, and I've heard good things, because one of the things I forgot to mention was that not only are ADHD women plagued with depression in many cases, but they also tend to have high levels of anxiety. And those two, depression and anxiety, tend to be the most prevalent coexisting conditions. And what I also heard at this conference was taking a stimulant and adding guanfacine, which goes by the brand name Intuniv, works really, really well to handle anxiety for women. So I just wanted to mention that. And I'm, again, not a physician. Check with your doctor about that. But that's just what I heard from the conference. And those guys seem to know what they're talking about, for heaven's sake.
Right.
In addition to medication, I know we're going to change one letter here and call it meditation, because mindfulness meditation with Lydia Zylowska, Dr. Lydia Zylowska wrote a book called The ADHD Prescription for Mindfulness. Great book. I invite you to check on it, because a lot of folks really do well with mindfulness, which is a little different than sitting there examining your navel and, sitting there and going all the time. It's different from that. It's much easier. You don't even have to sit still, for heaven's sake. And then the other gold standards that I think is true, that works for both ADHD and for depression, is exercise. And that research on exercise and depression has been done right here at Duke University, which is where my husband is a physician. But it certainly works amazingly well, because it stimulates those brain connections, if you will, and it stimulates norepinephrine. It also stimulates dopamine. So I had a client once upon a time who would go exercise for an hour, then he could work for 4 hours, then he had to go exercise for another hour, and then he could work for another 4 hours. So really important. And finally, for treatment, you can't do this alone. Or, well, I shouldn't say that. You can do anything you want. It's more difficult when you do this alone. So if you don't find a CBT therapist who works with ADHD folks, because there's a difference in traditional CBT, that's cognitive behavioral therapy, and ADHD, cognitive behavioral therapy. You can check out Mary Salanto's book about that. She wrote a book, amazing book, and did the original research there. You find someone like that who can work with you, and they will help you develop those skills. Working with a therapist on the self-esteem issues, a regular talk therapist on self-esteem issues. And also you can consider working with a coach like me, who also work with accountability and work with helping you set up new skills, et cetera, et cetera, et cetera. So if none of those things work for you, try to find a support group for ADHD women or ADHD girls. Those are harder to find, but you may find one in the therapist's office that may be doing that, which would be wonderful if we had more of them. But I've run the Meetup is a good place to look for them. I've run a Meetup support group here in the Triangle for about 15 years. And we still have women coming in who were just diagnosed, 2 weeks ago, who are beginning to learn about their ADHD. There's a huge increase, and we're having a wonderful upswing in diagnosis of ADHD women, because when we get to be adults, we can do a little more research. And fortunately for us, thanks to programs like this one, we begin to learn more about ADHD and realize, that could be me as well. So thank you for putting this on.
You're so welcome. And to add on to what you were saying, we have done now almost 70 interviews in the 2 toolboxes, and we've got so many different experts that are coming on and talking about different solutions. I know brain development has been a solution that's worked really well for thousands of people. We've also had neurofeedback that's worked well. I've talked to people around supplements. We learned a ton the other day talking to Dr. Sean Talbot about supplements, and we had Janine Stollard on, and she was talking about custom supplements where they test you for, where are you deficient, and sometimes it's as simple as that. Usually not. Usually not. Sometimes you just have ADHD symptoms and not full-blown ADHD, but usually you do have the full ADHD. And so there's so many different symptoms and so many different solutions. And coaching, I know, has been a big one. That's why there's so many ADHD coaches out there now. Didn't used to ever exist, and now they're out there. And in talking with Elaine Taylor-Klaus, of Impact ADHD, she was mentioning that and actually defined behavior therapy as ADHD coaching. And that's really what you're getting. You're getting behavior therapy so you can have somebody walk you through and start putting systems in place so your life gets easier. So certainly people like Linda can help with that. And that's why she exists in this community, just to give her knowledge and help you get through some of the challenges.
Yeah. Well,
and
I also
that
want to
brilliant
mention,
side, right?
yeah. Well, I want to mention too that Elaine Taylor-Klaus and Diane Dempster partner with me, and we do a Parents Palooza in the summertime too. So, and I think you mentioned that at the beginning, but Elaine does an amazing job with ADHD parents working with their kids. So I can't praise her highly enough.
Yeah, a true treasure in this community, and as is Linda and Dr. Hollowell and Russell Barkley and so many others that are here. And that's what I really like about this community. It's so warm. And if you're watching this for the first time and you've never seen anything about ADHD, then you know you're not alone. There's a huge community out there. We're all here to help, and we're all looking to access, really change the narrative. This is not just a disorder. This is like, there's something really good on the other side. If we can manage it, we can access it and start to live the life that we've always wanted. So thank you, Linda, so much for being part of our program. This has been an awesome conversation. And you also have a free gift. Can you tell us a little bit about your ebook that you're giving away today?
Sure. I would love to. Since I talked about hormones so much today, I've actually created an ebook about the ADHD hormone connection. Obviously, it's for women. Well, actually, it's not just for women. I talk about men's hormones as well.
Mm-hmm.
Men's hormones don't affect ADHD quite as often, let me just say, but it certainly can. In young boys, sometimes we see a little more aggression and a little more oppositional defiant, not OCD, oppositional defiant behavior in ADHD boys. As men age, sometimes they actually have the testosterone goes down a little bit, and sometimes that causes some memory issues. But that happens to all of us as we get older, I must say. So I don't know how we can tease that out, but it goes into a little bit more detail about how estrogen connects in your brain, and it's got lots of pictures. So if you're ADHD, it's got big print and lots of pictures. You'll be able to read it.
Fantastic. So make sure you download that free ebook down just below this video. If you have any questions for Linda, her email will be there, and you'll be able to connect with her as well as her website. So thank you so much for being a part of our program.
It's been an honor.
Fascinating conversation, and I really enjoyed it. And thank you all for watching this episode of the ADHD Toolbox. We will see you on the next episode.